Why do so many doctors deny that perimenopause exists? Well, I don't think that they're denying that it exists. I think they just don't understand the symptoms of early and late perimenopause. So let's define that menopause is reached when you are 365 days since your last cycle. If you had surgery that removed your ovaries, you are now in surgical menopause immediately, and whew, that's rough. Sometimes women go through menopause faster than others, and sometimes people's symptoms are different than others. 3 out of 4 women will experience the fun symptoms of perimenopause, but what most people don't understand is how the symptoms vary along that journey. And this is why we need doctors to understand how perimenopause and menopause affects women. But sadly, they weren't trained that in school. And so I think there's a lot of bad information out there thinking that, well, there's nothing you can do until you reach menopause, meaning 365 days since you have bled. And then at that point, they might talk to you about menopause hormone therapy, hormone replacement therapy. They might talk to you about an estrogen patch. They might talk to you about a pill. They might talk to you about compounded creams. They might talk to you about a progesterone pill. They might talk to you about a progesterone cream. And so we don't have to suffer with the symptoms of perimenopause and menopause. And if you would like to have an in-depth conversation with a doctor to help you through this transition, to help you manage your symptoms, but also please note, you're gonna have to hunt hard, and I apologize. So I recommend to people going to menopause.org, typing in your zip code, seeing where there's a practitioner near you. When you are sorely disappointed that there isn't anybody in a 50-mile radius, you can do telehealth with Alloy or MIDI Health. And then you can tell them your subjective reports. Now, of course, you have to talk to your doctor to make sure that you don't have a thyroid issue or a vitamin D deficiency. And there is blood work to be done to make sure there aren't other things happening. But there isn't blood work to tell you when you're in perimenopause. There is blood work to tell you how close you are to reaching menopause, which that is FSH and AMH. But I want you to know you don't need to suffer. And it was a little glitch in our education system for doctors, because women are not little men. And I don't think people realized how much estrogen and testosterone, progesterone affects all these systems of the body. I encourage all my people to read the book Estrogen Matters, and your mind will be blown about how important estrogen is to your body. Estrogen is not the bad guy that everybody thinks it is. And that's why me, a women's health physical therapist that tries to educate you on the science and physiology of your body, talks about this. I don't prescribe hormones. I help people change their exercises, their habits, and help them feel good in their body. But education is one of the most important things. And so our doctors need to be better educated. Yeah, but it's going to take a long time till that happens. We're not exactly in the enlightened period at this moment.